everyone, welcome back to my channel. In today's video, I will demonstrating the correct and safe way to performing urinary catheterization, a very critical nursing procedure. This video is ideal for nursing students and practicing nurses preparing for clinical settings. So now let's start with the basic. What exactly is urinary catheterization? Urinary catheterization is a medical procedure where catheter is inserted into the urinary bladder to drain the urine. There are generally four main types of catheter: straight catheter, Cody's catheter, Foley's catheter or retention catheter. Fourth one is three-way Foley's catheter. Now we discuss about these catheters one by one. So first is straight catheter. Straight catheter is generally used to drain the urine but immediately removes just after emptying of the bladder. And the second one is Cody's catheter. This catheter is more rigid than other straight catheters. This catheter may be used in male patients with prostatic hypertrophy, means in those patients in which their prostate size increases. The third one is Foley's catheter. It is also called as retention catheter or indwelling catheter. This catheter is double lumen catheter, large lumen used to drain the urine from the bladder. Small lumen catheter is known as inflation valve, used to inflate the balloon near the tip of the catheter to secure the catheter in place within the bladder. So fourth one is three-way Foley's catheter. This one catheter is used in those patients which requires continuous or intermittent bladder irrigation, and here third lumen is used to irrigating a sterile fluid into the bladder and then exits the fluid through the bladder into a drainage pot. Okay, and now the size of catheter. In adult male and female patients, the catheter size is 12 to 18 FR catheter, French catheter, and in children's also subcategories. In infants, 5 to 6 French catheter is used. In toddlers, 6 to 8 French catheter is used. In preschool children's, 8 to 10 French catheter is used, and in school-going children's, 10 to 12 French catheter is used. These conditions, urinary catheterization is performed. First, urinary retention, inability to urinate. Second, urinary incontinence, loss of bladder control. Third, monitoring urine output. Fourth, diagnostic procedures. Fifth, surgical procedures. Now, in which conditions urinary catheterization is not performed? First, urethral or bladder infection, urethral trauma or injury, urethral obstruction, bladder bleeding, and then patient refusal or anxiety. There are so many equipments used in urinary catheterization. First of all, we prepare a tray which contains a sterile urinary catheter of appropriate size according to the patient. This catheter is used to relieve urinary distension. And the second one is PPE kit, gloves, mask, apron to prevent from transmission of infection. And the third one is syringe, 10 cc syringe and sterile water to inflate the balloon, and then lubricant jelly to lubricate the catheter, which prevents from any irritation or injury. Example, xylocaine jelly, lidocaine jelly. And the next one is antiseptic solution to clean the urethra or urinary meters. And the next one is some cotton balls and gauze pieces to clean the labia majora, minora, urethra or urinary meters. Okay, and kidney tray, which is used to discard the waste like cotton balls, gauze pieces, etc. And then forceps to hold the cotton balls and gauze pieces for cleaning the urethral part. Okay, and the last one is urinary drainage bag to collect and store the urine. One thing is that this is adhesive dressing tape which is used to fix the catheter on the thigh. I will tell you the parts of urinary catheterization also. From proximal end, you see here the tip of the catheter which is inserted into the urinary bladder through the urethra. And you see here a small opening and small hole. It is called as drainage eye, which allow urine to the catheter tube. And below the tip of the catheter, a part is called as balloon, which is inflated to secure the catheter in place within the urinary bladder. A thin, long, flexible rubber tube which allow urine to the urinary drainage pot. From terminal end, there are two lumens, large lumen and small lumen. Large lumen is used to drain the urine from the bladder, and the small lumen is used to inflate the balloon. Okay, now start the procedure. Procedure consists 3 phases: preparing phase, performing phase, and third one is post phase. In preparing phase, prepare the patient by explaining the complete procedure of urinary catheterization to the patient to reduce anxiety or provide comfort to the patient. And then ensure privacy and consent, and ask the patient about any allergy or pain. Provide proper positioning to the patient, dorsal recombinant position given to the patient. And the last one is hand hygiene and wearing gloves to prevent from any transmission of infection. Okay, phase है performing phase. In this phase, perform procedure on the patient. So now हम procedure start करेंगे, ठीक है? So before starting the procedure, we all know we maintain a sterile field. It is more important. Okay. So first of all, cotton balls dip in antiseptic solution and clean the labia majora, labia minora, urethra meatus, and then urethra. One stroke of cotton ball is used to clean the urethra and then discard it in urinary tree. And next cotton ball is used for next stroke and then discard it. Just like that, we cleaning the urethral part. Okay. Now we hold the catheter in dominating hand and non-dominating hand spread the labia majora and labia minora to expose the urinary meatus. Okay. So you see here markings. This is marking from here. Open the catheter. Okay. So we open the catheter from here. देखिए हमने इसको ओपन कर लिया है. इस तरीके से हमें इसको रिमूव कर देना है. हमें अब इस अनओपन पार्ट को टच नहीं करना है, वरना ये पार्ट कंटामिनेटेड हो जाएगा, जो क्या है कि यूरिनरी ट्रैक्ट में इन्फेक्शन प्रोवाइड कर सकता है किसी पेशेंट में. तो इसको हम क्या है टच नहीं करेंगे. ठीक है. सो बाय नॉन डोमिनेटिंग हैंड spread the labia majora and minora to expose the urinary meatus and insert the tip of the catheter into the urethra. And now you see the flow of urine from the urine drainage pot. Okay. Then hold the catheter in place and you take a syringe and distilled water filled in 10 cc syringe to inflate the balloon, which helps to secure the catheter in place within the bladder. हमने सिरिंज को फिल कर लिया है, जैसे कि आप देख सकते हैं डिस्टिल्ड वाटर से. नाउ हमें इस निडल को अब रिमूव कर देना है. ठीक है. जैसे कि आपको पता है कि हमने डोमिनेटिंग हैंड से कैथेटर के टिप को इंसर्ट कर दिया है यूरिनरी ब्लैडर में, एंड नॉन डोमिनेटिंग हैंड से हम क्या करेंगे, हैंड से इन्फ्लेशन वाल्व है इसमें इसको इंसर्ट करेंगे सिरिंज को, देन वाटर को इंस्टिल्ड करेंगे. देन यू सी आप क्या देखेंगे, ये जो मैंने बताया था बैलून पार्ट, ये क्या करेगा, इन्फ्लेट करेगा. इसका काम क्या होता है, सिक्योर रहना अपनी प्लेस पर, यानी कि ये क्या करता है कैथेटर को सिक्योर करता है विद इन द ब्लैडर अपनी प्लेस पर. ठीक है. तो आप देखना जैसे मैं इसमें डिस्टिल्ड वाटर इंसर्ट करूंगी इन्फ्लेशन वाल्व से, ये क्या करेगा, बैलून इन्फ्लेट करेगा. यू सी हियर. एंड वन थिंग इज दैट आफ्टर इन्फ्लेशन ऑफ द वाल्व after inflation of the balloon, you just pull the catheter backward to check that catheter is secured or not. Then okay, so now I instilled water into the inflation valve and you see here balloon is inflated. Okay, just like that balloon is inflated to secure in place within the urinary bladder. देखा किस तरीके से हमने इसको इन्फ्लेट कर दिया है. ठीक है. ये इन्फ्लेट हो जाएगा इस तरीके से. इसमें 30 ml इसकी कैपेसिटी होती है बैलून की, किसी में 10 ml कैपेसिटी होती है. ये क्या करता है, सिक्योर रहने के लिए हेल्प करता है कैथेटर को, ताकि वो बार बार रिमूव ना हो सके, यूरिनरी ब्लैडर से अपनी जगह पर फिक्स रहे. ठीक है. अब इसके बाद हम क्या करेंगे, मैंने बताया था ये लार्ज ल्यूमेन है जिसको हम यूरिन ड्रेनेज बैग से कनेक्ट करते हैं. इसको अब हम यूरिन ड्रेनेज बैग से कनेक्ट कर देंगे. ठीक है. अब यूरिन ड्रेनेज बैग से कनेक्ट करने के बाद इस कैथेटर को हम फिक्स कर देंगे थाई के ऊपर, ताकि ये हिले डुले ना और ना ही कोई इंजरी वगैरह इरिटेशन वगैरह कोस ना करे. इसलिए हम इसको थाई पर क्या कर देंगे, फिक्स कर देंगे एडेसिव टेप से. इस तरीके से हम एडेसिव टेप, ड्रेसिंग टेप लेंगे, इसको थाई पर इस तरीके से हम इसको फिक्स कर देंगे ताकि अपनी प्लेस पर ये फिक्स रहे. ठीक है. अब हम इस लार्ज ल्यूमेन जो है कैथेटर हब इसको बोलते हैं, इसको यूरिन ड्रेनेज बैग से कनेक्ट कर देंगे एंड टुवर्ड्स द ग्रेविटी हम इसको प्लेस कर देंगे to just flow of urine from urinary bladder to the urinary drainage bag. Okay. Then after that, this is the phase of performing phase in which we perform urinary catheterization in the patient. After that, third phase is post phase. In this phase, remove gloves and perform hand hygiene to prevent from transmission of infection. After that, in the last, documenting the procedure time, date, characteristics of urine and monitoring output of urine. All these things recorded in nursing charts. Okay. वीडियो के एंडिंग में आपको मैं एक चीज़ और बताना चाहूँगी, जो हम कॉमन मिस्टेक्स करते हैं उनको हमें अवॉइड करना है कोई भी यूरिनरी कैथेटराइजेशन प्रोसीजर परफॉर्म करते वक्त. पहला, डोंट ब्रेक स्टेरिलिटी, मींस हमें स्टेराइल एनवायरनमेंट क्रिएट करना है इस यूरिनरी कैथेटराइजेशन प्रोसीजर को परफॉर्म करते वक्त, क्योंकि अगर हम स्टेरिलिटी मेंटेन नहीं करेंगे तो इससे पेशेंट को और भी ज़्यादा इन्फेक्शन क्रिएट हो जाएगा. वो अपना ट्रीटमेंट करवाने आया है, यूरिनरी डिस्टेंशन से रिलीफ पाने आया है, लेकिन आप उसको इन्फेक्शन देकर वो भेज देंगे. दूसरे थिंग, यूजिंग रॉन्ग साइज कैथेटर. डोंट यूज रॉन्ग साइज कैथेटर. After that, not inflating the balloon from its exit limit. Its limit is only 30 ml or 10 ml in some urinary catheter. Okay. And don't forgetting the documenting the procedure, date, time. मेरा वीडियो अच्छा लगा तो आप मेरे चैनल को सब्सक्राइब, लाइक कर सकते हैं, और अगर कुछ ज़्यादा ही अच्छा लगा तो आप अपने किसी दोस्त को शेयर भी कर सकते हैं. तो ऐसे नॉलेजफुल कंटेंट्स मैं आपको प्रोवाइड करती रहूँगी. थैंक यू सो मच.
Goodbye.